Have you ever looked down at your feet and wondered, could these actually reveal something about my internal health? Well, welcome to The Explainer. Today, we're launching a bit of a medical investigation. We're going to play detective at our crime scene. It's right there at the ends of your legs. We're looking into how our feet might just be leaving some critical clues about the health of one of our most vital, hard-working organs, the liver. Okay, let's dive into this. So here's the map for our investigation today. We'll start with clues from your feet, then look at fluid, skin, and color changes. After that, we'll dig into deeper signs involving your blood, nails, and nerves, look at the bigger health picture, and finally, go over how to actually protect your liver.
All right, part one, clues from your feet and the system connection.
So, can your feet really reveal liver problems? Short answer, absolutely. Yes, they can. You see, the liver is this notoriously stealthy organ. It's basically a massive biochemical factory, constantly filtering your blood, processing nutrients, balancing fluids, and because it works so quietly behind the scenes, early problems often just slip completely under the radar. But when its functions start to slip, those changes cascade right through our circulation and our fluid balance. And because of gravity, well, we often see those subtle changes first right down in our extremities, our feet.
But wait, before we go any further, we really need to do a major reassurance check here. We are talking about clues, not diagnoses. If you spot one of these signs on your own foot while watching this explainer, please do not panic. Honestly, these physical signs can be caused by incredibly common everyday things. You know, wearing tight shoes all day, having dry skin, or just clumsily bumping into a coffee table. Persistent or totally unexplained symptoms should always be evaluated by a medical professional. We're just here today to learn what to look out for.
Section 2. Fluid, skin, and color. These are the surface-level signs. Now, what's really interesting about this is how much our internal chemistry affects our outside appearance.
In this part, we're investigating our first 4 clues: swollen feet and ankles, persistent itching, yellowish skin, and unusual redness on the soles of your feet. These 4 all relate to fluid buildup and surface-level skin changes, so let's break them down one by one.
Clue number 1 was swollen feet and ankles. Now, the liver produces this absolutely crucial protein called albumin, and albumin acts kind of like a sponge. It keeps fluid tightly inside your blood vessels. But in advanced liver disease, the liver just stops producing enough of it. Without that sponge, fluid leaks out, and thanks to gravity, it drops straight down and accumulates in your legs and feet. You might notice your shoes suddenly feel incredibly tight. You might even see something called pitting edema. That's where, if you press your finger into the swollen area, it literally leaves a visible indentation that takes a few moments to fill back in. But remember our reassurance check. Prolonged standing, heart problems, or kidney issues are much more common culprits for swelling. But if it appears suddenly out of nowhere, or especially if it affects your breathing, that's when you definitely need prompt medical attention.
Moving right along to clue number 2, intense, persistent itching, specifically on the soles of your feet or the palms of your hands. What's fascinating here, and obviously super frustrating for anyone dealing with it, is that this itching happens without any obvious rash, like nothing is there. Why? Because when the normal flow of bile in your liver gets disrupted, bile salts and other substances can actually accumulate right under your skin. It feels like this deep, unscratchable itch. Of course, you absolutely have to rule out benign causes first. Eczema, an allergic reaction, may be a fungal infection, but unexplained itching that just persists for weeks, that is for sure a clue worth investigating.
All right, clue number 3 is yellowish skin, a condition you've probably heard of known as jaundice. Jaundice happens when a yellow pigment called bilirubin builds up in your bloodstream. Normally, your liver, when it's healthy, just processes this bilirubin and clears it right out. But if the liver is failing, or say a bile duct is blocked, that yellow pigment builds up and literally stains your tissues. Now, while you might notice a yellowish tint on your feet, honestly, it's usually easiest to spot first in the whites of your eyes. And it's often accompanied by things like very dark urine or unusually pale stools. Make no mistake, this is a classic red flag. If you see this, you need a doctor's visit, no question.
Clue number 4 is unusual redness on the soles of your feet, or sometimes even on your palms. Chronic liver disease can actually alter how your body metabolizes hormones and regulates its blood vessels, and that can lead to a persistent, flushed, really red appearance in your extremities. So the crucial point is this: red feet are extremely common. Seriously, if you just went for a run, wore heavy socks in a hot room, or just have a minor skin condition, your feet are going to be red. You really have to look at this clue in combination with other signs. It's just one piece of the puzzle.
Section 3, blood, nails, and nerves. We're looking at deeper systematic changes now.
The final 3 clues in our investigation are easy bruising, toenail changes, and tingling or burning sensations. Notice how we're shifting gears here. We're moving away from localized skin issues and getting into much deeper systemic and neurological changes.
Let's look at clue number 5, easy bruising. The liver isn't just a filter, it is a full-blown manufacturing plant. It produces several essential proteins that your body absolutely needs to form normal blood clots. When liver function is severely impaired, it just stops making enough of these clotting factors. Because of that, you might find these mysterious, unexplained bruises just popping up on your legs and feet. Or you might notice that a tiny little scratch just keeps bleeding for way longer than it should. Now look, we all bump our legs on the furniture sometimes, right? And certain medications for sure cause bruising. But frequent, totally unexplained bruising? That should never just be ignored.
Clue number 6 involves your toenails. Chronic systemic illnesses, and that includes advanced liver disease, can severely affect how your nails grow. You might see nails that become entirely white, brittle, thickened, or just oddly discolored. But hey, before you jump on your phone and start panic searching your symptoms online, let's be absolutely clear about something. Nail changes are nowhere near specific enough to diagnose liver problems on their own. Fungal infections, basic nutritional deficiencies, or literally just the normal aging process are the usual suspects here. So don't self-diagnose. Just view your toenails as one small clue in the wider investigation.
Our final foot clue, number 7, is peripheral nerve problems. We're talking about experiencing persistent tingling, numbness, or a really uncomfortable burning sensation in your feet. Chronic liver disease can actually lead to neurological issues that damage these peripheral nerves. However, it's vital to know that diabetes is by far one of the most common causes of this burning or numbness. Things like alcohol use, a pinched nerve, or just vitamin deficiencies are also super typical culprits. But if your feet are constantly tingling, and particularly if you are diabetic, you definitely need to bring this up with your healthcare provider.
Section 4. The bigger health picture. Systemic warning signs. And this brilliantly illustrates why context is everything.
You see, while foot clues like swelling, redness, and itching are super helpful hints, the real, undeniably loud red flags are the systemic, full-body warning signs. We are talking about persistent fatigue, dark urine, pale stools, severe abdominal swelling, unexplained weight loss, and nausea. If you just have itchy feet, you probably just need some good lotion. But if you have itchy feet, yellowing eyes, and you're dropping weight without even trying, okay, that is a pattern that requires immediate attention from a doctor.
So here is the ultimate takeaway. Your feet alone cannot tell you whether your liver is healthy. Remember how we called the liver a stealthy organ earlier? Some liver conditions can develop for years without causing any obvious symptoms at all in their early stages. Physical signs on your body are helpful hints, for sure, but a proper medical evaluation and specific blood tests, those are the only true lie detectors for liver disease.
Section 5. Protecting your liver. Taking action today. Let's move to our next point and see how this builds into an action plan.
Protecting your liver really comes down to a super simple 3-step procedure that literally anyone can start focusing on today to support their overall metabolic health. Step 1 is managing your lifestyle basics. Step 2 is fueling up with a balanced diet. And Step 3 is actively seeking medical evaluation when you need it. Let's unpack Step 1 with a quick checklist. Maintaining a healthy weight and staying physically active are incredibly good for liver health. Limiting alcohol is kind of a given, as is managing conditions like diabetes and high cholesterol. But look really closely at those last 2 points. Avoiding unnecessary supplements and limiting acetaminophen, which is also known as paracetamol. You know, people are often completely shocked by the danger of exceeding standard doses of common over-the-counter painkillers. Your liver has to process every bit of those, and taking too much can actually cause acute liver damage. So please, always read the label. Moving on to steps 2 and 3. A balanced diet is what actually supports the liver's heavy lifting. We're talking about a plate rich in veggies, fruits, whole grains, legumes, and lean protein. I know, it sounds basic, but this is literally the premium fuel your metabolic factory requires to run. And finally, if you have risk factors for liver disease, maybe a family history or metabolic syndrome, don't wait for your feet to swell up. Talk to a doctor proactively about liver function testing and getting some routine blood work done.
Well, we've covered a lot of ground today, haven't we? Everything from albumin fluid leaks to bile salt itching. Just remember, pay attention to persistent changes, seek early evaluation to make a major difference, and never, ever rely on just one symptom to tell you the whole story. I want to leave you with a quick question to ponder. Which of these warning signs surprised you the most? Think about it. And hey, if you found this explainer helpful, please share it with someone who might benefit from decoding the clues their own body is sending them. Thanks so much for joining me on this investigation today.